Hello and welcome. Today we are going to talk about co-occurring disorders. So, what are co-occurring disorders? Co-occurring disorders describe the presence of both a mental health disorder like anxiety, PTSD, depression, or any of the psychotic disorders we talked about, and a substance use disorder in the same person. Now, comorbidity is a broader term referring to two or more conditions, which could be mental health, substance use, or physical health. So this could be heart disease or diabetes. So that's what comorbidity is. Prevalence in the US. Co-occurring disorders, also known as dual diagnosis, are common. The National Survey on Drug Use and Health found that 1 in 4 people with a mental health condition also had a substance use disorder. These combined conditions can complicate treatment and increase risks. All right, let's check out this video.
Drug use is often associated with health harms. Infectious diseases such as HIV and AIDS and hepatitis C have clear links to drug use. There are also links between drug use and mental health problems that we need to consider. People with problematic forms of drug use often suffer from both a substance use and mental health disorder. The coexistence of a substance use and mental health disorder in the same person is usually called psychiatric comorbidity in people who use substances, or dual diagnosis. There aren't many figures on the extent of mental health disorders among people who use drugs, but the numbers affected can be very high, up to 80% in certain groups of drug treatment patients. Depression is the most common mental health disorder associated with substance use, but anxiety is also often seen, and comorbid substance use disorders are more common in people with psychosis. Compared with people who have only a drug use or mental health problem, people with comorbidity have more emergency admissions to general hospitals and to psychiatric hospitals, and more of them die by suicide. Substance use and mental health disorders are interlinked in different ways, which are sometimes overlapping. In some cases, a mental health disorder can be considered a risk factor for drug use, which may lead to the development of a substance use disorder. In other cases, drug use can trigger the development of a mental health disorder. Clinical practices also show that comorbid disorders often interact to make each other worse. It is often difficult to diagnose comorbidity among people who use drugs. For example, in a person entering drug treatment, acute psychiatric symptoms might be attributed to their drug use, or the effects of withdrawal or intoxication from drugs may be misinterpreted as psychiatric illness. Patients need careful diagnosis and integrated treatment, where the two disorders are treated at the same time with knowledge keepers from both fields working together. Providing this level of care is a major challenge for all parties involved.
All right, so the important pieces of this video are that psychiatric comorbidity that we talked about, and that we really need integrated care, because the important thing is that it's hard sometimes to differentiate between what is causing these symptoms. Is it mental health or substance abuse? And we're about to get into that. Okay, so substance and associated disorders. So I thought it'd be really interesting to take a look at what are the different substances and what mental health disorders do we normally see that overlap with them. So alcohol, a central nervous system depressant, often used to self-medicate anxiety or depression, potentially worsening these conditions over time. So with alcohol use, we see depression, anxiety, and PTSD. With cannabis, it can increase anxiety and is linked to psychosis onset, especially in those predisposed to schizophrenia. So with cannabis, we see anxiety disorders, schizophrenia, and other psychotic disorders, and we also see bipolar disorder, which can have psychotic attributes. Opioids. Opioids used to numb emotional pain, leading to physical dependence and worsening depressive symptoms. So we normally see depression, PTSD, anxiety disorders, and chronic pain. Stimulants temporarily improve focus and mood, but often cause agitation, paranoia, mood swings, or worsening psychosis. So a lot of the mental health disorders that we might see with stimulants are ADHD, bipolar disorder, anxiety disorders, and schizophrenia. Inhalants. So these are used for their dissociative effects, but can cause severe neurological damage. So with inhalants, we often see impulse control disorders like OCD, anxiety and depressive disorders. So you might be asking yourself, what comes first? Is it the mental illness or is it the substance use? Well, that's a really intense question with a lot of answers. So I'm going to try and go over it at like a surface level. So if mental health comes first, sometimes a pre-existing mental health condition leads to substance use as a coping mechanism. If substance abuse comes first, substance abuse triggers or worsens mental health issues. So, as we talked about, sometimes they have found that there's been studies on this, that use of cannabis in people that have schizophrenia predisposition can bring about the schizophrenia at maybe a younger age than it would have onset before. But also, it can worsen anxiety disorders, depression, um, as we talked about in the last slide. And other substances can have different effects on other mental illnesses. Sometimes the conditions are intertwined. So frequently, both conditions are intertwined, necessitating a dual diagnosis approach for comprehensive treatment. Sometimes we don't know which one came first, but we just know they're both present, especially if drug use onset was at a very young age. So if we have mental health diagnosis preceding substance use, so substance use to navigate symptoms. In many cases, individuals use substances to self-medicate the symptoms of an existing mental health condition. For example, someone with anxiety might use alcohol or benzodiazepines to reduce stress. Someone with depression might use stimulants like cocaine or methamphetamine to boost energy or mood. The key issue is that while substances may provide that temporary relief, they often exacerbate the original condition over time or lead to new problems such as dependence or additional mental health challenges. So, substance use leading to mental health diagnosis, and I talked a little bit about this, but substance-induced mental health disorders, prolonged or heavy substance use can directly cause mental health symptoms or disorders. For example, chronic cannabis use may trigger psychosis in predisposed individuals. Long-term stimulant use can lead to anxiety or paranoia. And we also have talked about this, but meth-induced psychosis is something that can be caused by stimulant use, methamphetamine in particular, because it actually eats holes in the brain. Alcohol use can cause depressive symptoms due to its depressant effects on the central nervous system, can also cause anxiety. So substance medication-induced mental disorders in the DSM-5, this specific category is used when mental health symptoms are clearly caused by use or withdrawal. So then there's the biodirectional influence, right? And that means there's a cyclical relationship where substance use worsens mental health symptoms, which in turn lead to more substance use. For instance, someone with PTSD may use alcohol to cope with flashbacks, but alcohol may worsen sleep disturbances and emotional regulation, perpetuating the cycle. So each one worsens the other one, and then it just starts spiraling. Some with depression may use opioids to numb emotional pain, but over time, the opioids worsen depressive symptoms, right? Because what we talked about earlier is the brain stops regulating as well because we're using drugs to regulate our brain. Okay, so if we look at co-occurring disorders and crisis, so higher crisis rate, so individuals with, we call them CODs, co-occurring disorders, experience crisis, overdose, self-harm more frequently. They have a challenging presentation. Symptoms overlap, making it difficult to distinguish between intoxication, withdrawal, and mental health crisis. There's multifaceted needs. So simultaneous mental health and substance use interventions are often required. And this is that integrated care piece. Escalating emotional responses. Individuals might exhibit escalating emotional responses, such as agitation or withdrawal. So challenges in assessing co-occurring disorders, the overlapping symptoms, so the depression, the anxiety, the psychosis, can stem from mental health disorders, substance use, or withdrawal, stigma and mistrust. Individuals may fear judgment, hiding substance use or mental health issues. Barriers to diagnosis, limited access to integrated care systems. Crisis situations often prioritize safety over full assessment, so you might not even have the time to assess for both. So the skill we're going to learn today is the 4Ps framework. The purpose, a simple framework to guide initial assessments and determine the primary area of concern. So we want to start with the first P, which is presenting problem. So what symptoms or behaviors are occurring? Okay, so maybe there's agitation, withdrawal, erratic actions. What is their past history? Does the person have a history of mental health or substance use issues? Example, previous psychiatric diagnosis or substance dependence. So we look at their history. Pattern of symptoms. Are the symptoms more consistent with mental health, substance use, or both? So the example is sudden onset after substance use might suggest intoxication. A gradual decline might indicate a mental health disorder. Precipitating factors. Was there a recent event or trigger, like a loss of a loved one, a traumatic incident, or drug use? So we're going to take Jenna. The mobile crisis unit is dispatched to a call involving Jenna, a 36-year-old woman living in a rural area. Jenna's sister, Megan, reports that Jenna has been increasingly withdrawn and displaying erratic behavior. Megan found empty bottles of alcohol and prescription painkillers in Jenna's bedroom. Jenna has a history of depression, but has not been taking her medication consistently. When the team arrives, Jenna is agitated, pacing the room and muttering to herself. She refuses to sit down and says, "I can't stop the thoughts. They won't leave me alone." Jenna appears disheveled and avoids direct eye contact. So here we are using the 4Ps framework. So presenting problem observation. Jenna is visibly agitated, pacing and reporting intrusive thoughts. Her speech is fragmented and she appears disoriented. Team member response. Jenna, it sounds like things have been overwhelming for you. Can you tell us what feels hardest for you right now? Jenna shares that she's been feeling stuck and unable to focus. Past history, information gathered. Megan explains that Jenna has a history of depression and has been prescribed antidepressants, but often skips doses. Jenna recently started drinking heavily and using leftover painkillers from a surgery last year. Team member response. Thank you for sharing this with us, Megan. It's helpful to know about Jenna's medications and how she's been feeling recently. So, pattern of symptoms. Here's our assessment. The team identifies a pattern of escalating symptoms. Increased substance use coincides with worsening depressive symptoms. Jenna's agitation and intrusive thoughts suggests a combination of mental health and substance use challenges. Team member response. It sounds like things have been building up for a while, Jenna. Sometimes when we're feeling stuck, it can be hard to see a way forward. Let's work together to figure out some next steps. All right, so then we look at the precipitating factors. Identified triggers. Megan shares that Jenna recently lost her job and has been isolating herself. Jenna acknowledges that the stress of unemployment led her to start drinking more. Team member response. Losing your job must have been really hard, Jenna. It makes sense that the stress would feel overwhelming. We're here to help you find ways to manage this. So the outcome, using the 4Ps framework, the team identifies the immediate challenges Jenna is facing and the factors contributing to her current state. This structured approach helps the team develop a focused action plan that includes a safety assessment, referral to a dual diagnosis treatment program, and support for Megan in understanding co-occurring disorders. So debrief discussion. How did the 4Ps framework guide the assessment? Well, it provided a structured way to gather relevant information and identify connections between Jenna's mental health and substance use. How did the team use the framework to address Jenna's needs? By understanding the presenting problem, past history, patterns, and triggers, the team was able to create a targeted intervention plan. So key points. Co-occurring disorders are common. Mental health issues and substance use often coexist. CODs complicate treatment. Some systems overlap, requiring specialized care. Early intervention is crucial. Addressing both mental health and substance use can lead to better outcomes. And the 4Ps framework provides a tool for initial assessments and identifying key areas of concern. I hope this was beneficial. Thank you.